Welcome back. Open enrollment for Medicare Part D begins Monday, and there are some changes this year that could impact thousands of Kentuckians. You can get your questions answered today by calling our phone bank. It'll be open through the rest of this newscast until 1 o'clock. The number is 859-294-6090. And we're pleased to have with us here in our studios Angela Zeke, a paralegal and SHIP coordinator, and also Bob Foster from the Centers for Medicare and Medicaid Services to tell us about the plan and the enrollment process. Thank you both so much for being with us today.
Thank you.
We'll start with kind of the general overview during this enrollment period. What's the main things that people need to know about the process?
Well, every fall we have this annual enrollment period, this open season, where people have gotten information in the mail, they've gotten their Medicare handbook, and they've gotten some other literature from the plan that they're on now, and we ask them to look forward into next year and think which plans should they be in for next year, because the premiums change, the drugs that are covered may be changing, or the ways that they're paid for may be changing. So we want people to look at the new material and consider should they stay in the same plan or not. And that begins next Monday. So November 15th through the end of December is this annual enrollment period every year for Medicare health plans and drug plans.
And this is really an individualized process because it can vary depending on the types of medications you need, right?
Absolutely. And so it really is so specific that a husband and wife may not need to be on the same plan. In fact, usually won't need to be on the same plan. So every individual on Medicare needs to look at this.
And as far as Kentucky goes, I know that you guys have some statistics about some of the differences and how it could impact Kentuckians. What are you seeing so far with this plan?
Right. We have currently, for 2010, 43 different prescription drug plans. We're going to see a decrease for next year down to 32. We also have some Medicare Advantage plans that are deciding to terminate their contract with Medicare. And so those members need to make sure that they are comparing policies for next year and getting enrolled into one that's going to best fit their needs.
Will they necessarily know that the plan they have currently is going to not be offered anymore? Will they get warnings about that? Or what's the best piece of advice on knowing if your plan's still going to be around?
The plan company should have sent notification to them last month in October. And if they forgot or didn't look at their mail, they will receive additional information from CMS this month. But if there's any questions or concerns, they can certainly call Medicare, or they can call their local SHIP program, and we can take a look at their records and see what is going on with their particular plan for next year.
And what are some of the most common questions or concerns that individuals may have during this enrollment process?
Well, one question that we frequently get is, do I need to do this? If I'm somebody who's not taking any prescription medications, if I'm healthy enough to be in that great situation, do I need one of these? And, the answer, I think, is that it's insurance, and it's a decision that you have to make yourself. But people need to understand that if they wait to get one of these Part D plans after they're originally eligible for it, the way the law is written, there's a penalty of 1% that will be added onto their premium if they ever do join a Part D plan, but do it later, and that's a permanent increase in what their premium will be. So it's important to decide now, and if, the way to do it may be, if you're not on medications, is just get one of the cheapest plans. That gets you in the door and protects you from the penalty.
Well, certainly some important information. And again, we remind you that we have a panel in our phone bank ready to answer your questions. We know there's a lot to sort through, so we want to get you the information that you need. 859-294-6090 is the number you can call. And we thank you both so much for being with us today, and hopefully a lot of our viewers will take advantage of this service.
Thank you very much.
We will be right back with more news after this.